Thank you, everybody, and good afternoon. I have no idea what day or time it is, really, but at any rate, glad you're all here. As she said, I'm Kate Fulb. I'm director of Hollywood Health and Society, which is a program of the USC Norman Lear Center. We're proud to be sponsoring a number of panels here at ATX this time. And directly after this panel, we're hosting a happy hour, so please join us for that as well. You're excited about that, I can tell.
I saw some really excited faces. They're like, what?
I was going to say, this is the trailer for that show.
Free, yeah. All right, so today's discussion is broadly around women's health, but more specifically, we're going to focus a lot of our time on a topic that affects all people with breasts, and that is breast cancer and related issues around that, everything from how it affects the family, how it affects the one going through the journey, and also it's not all bad. It doesn't have to all be bad. So first of all, though, let's welcome the panel. Zoanne Clack, executive producer of Grey's Anatomy and Station 19. She also happens to be co-chair of our board of Hollywood Health and Society, so yay. Kristi Korzec, writer for Superman and Lois, among many other shows, one of which I just have to say that she wrote on It's Always Sunny in Philadelphia, which is just like such a... And then we have Matt Selman and Renee Ridgely. Matt is the showrunner and EP of The Simpsons. And Renee is an actor and activist, also on The Simpsons.
And a breast cancer survivor.
And breast cancer survivor.
And I'm married to him.
And they're married, yes. Happily, I'm sure, right?
Sometimes. 25 years, yeah. Oh, yes.
So, right on. Yeah. Almost as long as the show, right?
Shorter than the show.
Yeah, but...
The show's 35 years.
Oh, the show's 30. I was thinking 30 years. Oh my gosh.
Well, listen, I don't know them, but he was willing to give her the shirt off his back because she was cold. So I think they're happily married.
There you go. That's right. I witnessed that. Okay, so Zoanne, Grey's Anatomy, what season are you guys in? 19? 20?
Going to 20.
20 years. You've got some longevity here with 35 years, 20 years. So, come on. Come on, Kristi.
I don't know if Superman and Lois is going to have any more years, but
But you have how many so far?
3.
3. All right, that's
Three
all
solid
good.
years.
It's all good. 3 years is 35 in today's years, right? Anyway, Grey's has done a ton of breast cancer storylines. Ones that I know just off the top of my head, one that actually featured a young Justina Machado, where she's a woman who's just given birth and she finds a lump and they tell her it's a clogged milk duct and not to worry about it. And so that's one storyline. I'll let you go into more detail. Another one more recently was Maggie's mom has inflammatory breast cancer, and that was a really interesting storyline. And then there's one that just happened this season, which I'm not as familiar with yet, but maybe some of the people in the audience are, but had to do with Toby, and also, I think, inflammatory breast cancer. And so anyway, tell us about working on the story or the issue of breast cancer on Grey's Anatomy.
I feel like just as you were saying that, it feels like a lot of the stories are about advocacy and about like women advocating for their own health and women advocating for what they know, they know their bodies and they know what's wrong, and to have other people telling them, what's going on. Because I think you're going to get into this later, but especially for the inflammatory breast cancer story, one of the writers that was on the show at the time knew a lady who watched our show and had some, a rash kind of on her breasts and been told do this, do that, whatever, and she watched the show, went back and said, I really think I needed to be tested for inflammatory breast cancer. That it was that. She caught it early, and she's alive to this day. So, it's about like knowing your body and advocating for yourself. And with the clogged breast duct, it was a woman who had, been told that it was a clogged breast duct because she had just had a baby. And the actual storyline behind the issue was that she had been blaming her baby, and she had been really kind of distant from her baby, because if she hadn't thought it was a clogged breast milk duct, then she might have gotten, treatment sooner. So that was kind of the story behind the issue. So, there's always going to be stories behind issues. And then with Maggie's mom, obviously it was the relationship between Maggie and her mom. And we got into it through that breast cancer story.
Yeah, and I think actually the newest one about Toby brings up issues for the show's characters who have, for Maggie and for other characters on the show who had, been in previous breast cancer storylines. So it sort of brought all of that back to the front. So Kristi, Superman, and Lois, woohoo, just this season, and I hope you guys have all watched it because there might be a spoiler or two in here, but the whole season deals with Lois facing breast cancer. So tell us about it.
Yes, this season, Lois Lane, she and Clark, the season starts off with them in a very lovely, frisky kind of moment in their lives. They're having lots of sex. Her breasts are swollen. She thinks like, maybe I'm pregnant. And then it turns out to be inflammatory breast cancer. We definitely felt like we talked to Hollywood Health and Society has been so instrumental in us getting this story right. Most of the writers on the staff have been touched in some way by breast cancer, whether it's a family member or a friend, and we all felt very strongly about doing a story on it this year, but not just one episode. It's a full season arc, and we wanted to show her learning about it, having to tell her family, how it affects her and her husband, who happens to be Superman, but is very much powerless when it comes to this disease that he can do absolutely nothing about. So it's like, he's fighting bad guys, but at home, he is threatened with maybe losing the person he loves the most. But then we also continue through and I don't know, by the end of the season, which hasn't aired yet, I maybe should, well, it does, whatever. We wanted to show the full journey and show someone not just worried about having cancer and dying with cancer, but living with cancer. And we try our best to show her actually, she continues to work when she can. She very much, her family is important, but we really wanted to show the full spectrum. And we felt like it deserved a full season.
Yeah, I thought it was so interesting that, Lois, she's a scrappy investigative reporter, right? And she actually uses her, when she's going in for chemo, as a cover to investigate, a guy that she thinks is doing nefarious things. So, who happens to own this cancer treatment hospital. So it was almost like, in a way, you made it her superpower, or like a benefit for her in her work, that it wasn't only this thing that's going to make her sick and debilitating. It was something that was augmenting her career, and she continued with her career and her family and all the rest of it. So I thought that was really interesting that you guys did that.
I never thought it would be on a superhero show that I would have gotten to write about this storyline. But it's like, when you are doing that, you do end up having a cancer patient who is on full investigation, but it works for our character. And we, Health Hollywood and Society connected us with this incredible couple, and this woman who was continuing to study for the bar while getting her chemo treatment. And she said she would fall asleep And then she'd wake up and she'd keep studying. And we really were inspired by her and used her as, because we were like, that feels the most Lois Lane. That's the most Lois Lane story we could possibly hear. So we're like, okay, so it's not crazy for her to like grab her little like chemo bag or her treatment and kind of go stalking around the facility. So it was like on this show that's so heightened, it was nice to have a reality-based person who we could kind of, graft our story to. But it's been researching and going through everything. Like Zoanne said, I am constantly, when we've been writing stories, you can ask any of the women on the staff, we were all giving ourselves like self-exams while working on the episode. It's like, you just are reminded that you are the one who knows your body best. And doctors, they do their best and try, but you know your lumps, you know your curves, you know what's weird, the skin variations and things. So we're hopeful that like using Lois Lane as a representative on TV, just as someone as a reminder, just, check that body, check those lumps.
Check that body. I could see us. Yeah. Check that body.
Yeah, your lady lumps.
So that's a nice segue to Renee. And I don't know.
Because I'm missing lady lumps.
Yeah, I mean, tell us about that. And
Right. It's interesting listening to these stories because they're about the journey of treatment. And the story, the character that Matt and I brought to The Simpsons was someone who's passed her treatment, and so she's into survivorship, and what does that look like? And for 320,000 women will be diagnosed with breast cancer every year, and 100,000 of them will have 200,000 will have mastectomies. And about 100,000 will get implants or have tissue moved to build their breast back. And another half of them, the other half, 100,000, will go flat. And you don't see them because it's really easy to put a breast form in a bra, or just wear clothes that have ruffles and lace and things. It's just really easy to camouflage that. But I'm part of a community, and I did have implants originally, and I had to remove them for health reasons. And I'm part of a community that is really just kind of proud of my body and all it went through. And it looks very different than it used to. And I don't feel the need to hide it. I also agree with anybody who wants to have a silhouette that looks similar to what it used to look like. So that's part, the story that we have, that Wendy Sage has been able to tell, and her friends now on the show, is that bodies look different after cancer treatment, and you can still rock it.
yeah. So Matt, who pitched that character? For the only man on this panel, there was going to be another dude, I promise you, and he had a show that they had a man on the show that had breast cancer, and unfortunately he got COVID and couldn't come. But anyway, so as the only man, but also, tell us more about this character. Did Renee pitch this character to you? Did you come up with?
It was well pitched. A lot of marriage walks about this character. One of the, I don't take up too much time, but one of the great things about The Simpsons is that it holds up like kind of a mirror, a Springfield mirror to America and to society. And we try to use animation to be as specific and observant as we can in so many ways. And one ways that we really never had, certainly, was in terms of people with, who lived through terrible diseases, and specifically breast cancer. And Renee just wrote the word uniboob on a card and put it on the board, and was just like, uniboob, uniboob, uniboob. And, we found a great story about body acceptance, and we put this Dr. Sage character on the show, and it just was like I think it is in the spirit of The Simpsons to reflect America and society, but it's also a little bit shows maybe how our show has evolved a little bit in that we're doing things that are, that might make some people uncomfortable or sad or whatever, but are super real. But she gets all the credit. I deserve no credit.
And uniboob is a term of endearment, by the
Yes.
way. Like unis, they call themselves unis, and we're flatties. And that's just saying it's not all bad. Like in survivorship, it's really nice to be in community and to and just have quirky little terms that you call yourself instead of hiding it and going like, yeah, I'm uni, I rock it, and then one boob. So, so we can say uni boob here.
Well, and I think that goes back to the advocacy thing, and stick up for yourself and for your body, and not to be ashamed and to be empowered. I think you were going to say something, Kristi.
I was to the uni boob of it all. I love this. It's a safe place for uni boob. Also on the show this year, I got to write just a conversation between Lois and Lana talking about, she's nervous about her upcoming mastectomy. They definitely, uni boob comes up, but also in the way of, it's two women talking about when they were kids and first got boobs. And in the story, I have some of my own life and my mom's life who only had one boob for the first year of her life. And I think it's so interesting that we as women, I don't see those conversations on TV. And I've had so many people write me being like, I only had one boob. So it's just interesting to think that our bodies start off in different shapes, and even in the middle, we're all got different things, but we just don't really talk about it. I feel like there's only one silhouette that gets the most attention. Just talking about women's health on TV, period. It's just talking about periods. Talking about any of these things don't really get a place, and even in our real world of trying to make sure we don't talk about menstruation, which is a shame because this is the cradle of civilization. We should be instead of hiding our tampons and things when we go to in the office, go to the bathroom, we should be like, I'm menstruating, and everyone should applaud. It's like Oprah. Everyone's excited for you. Anyway, tangent, sorry.
I could go on this tangent because I remember a comedian talking about how, she's having a meeting with somebody, very important meeting, and she's thinking in her head, I'm menstruating right now. What if I just said that? But it's true. And then we also worked with a film in India, which was called Padman. And it was about a guy who invented a device to create pads for people in rural India that couldn't access pads, and they did a whole thing about show your pads, and it was a whole Instagram. Anyway, we get off on a tangent. Zoanne, go ahead. What were you going to say?
Oh, I was just going to add that menopause is one of the other things.
Yes.
We're doing more and more of, but need more and more of.
Yes, because I feel like it's hidden what women are going through for some reason, and it's I don't know, the more we talk about it, the more other women can feel like they're not alone and isolated, and
And menopause is thrust upon so many breast cancer patients.
Right, yes.
It's sometimes in their 20s, and that can be far more traumatic than almost all of their treatment for someone in their kind of prime of their life to be thrust into hot flashes and dry vaginas and loss of libido, and those are very quality of life decreasing elements for those women. So menopause at all ages is kind of pushed away. And I sometimes I see that in the breast cancer community. They kind of oh, it's all about the hair and the boobs. It's oh no, it's about the hormones going on and hormone suppression, stuff like that. So those are really important, I think, storylines that if anybody here is writing and thinking about putting those into storylines, those are, great topics. It's certainly a disease that young women have a hard time with.
Has Marge gone through menopause?
Well, they don't really get older.
I think this is a storyline that needs to be explored.
So that would be great. Could. We have a lot more episodes to do, so
I love seeing him uncomfortable.
Nothing is off the table.
A Halloween horror, perhaps? You guys they get old. No!
I believe she's had a 1-year-old for 35 years.
Well, that's true. That is true. But maybe she's
Matt
just short.
Matt and I always joke that we want to see Manopause the musical because there's so much man stuff that happens.
Well, let's not make it about us, honey.
Oh, it's not about man. I think it would be.
Okay. Well, so all of them, the storylines we've talked about, and other, tangential, ancillary issues around breast cancer and women's health, it's not just, and this is why I wanted to title this session beyond the very special episode, because it's not just about Marge has breast cancer and by the end we're going to have resolved it all or whatever. It's the family has breast cancer, what's going on with the caregivers, what's going on with, Superman, with Clark and having to deal with her kids. It's also about, there are often these depictions of women with an illness being courageous, and they're always, positive. And yes, that's part of it, but there's also times to be vulnerable and sad and scared and all of the rest of it. And I think all of these shows have kind of explored a lot of those additional issues. Clark goes to a support group because he's Superman and he can't save his wife, So what made you decide to go dive in deeper and to get to some of these issues that weren't specifically about her disease?
I think so. Our showrunners, one of them, his mother-in-law had breast cancer, and it really affected his entire family. And as we were discussing this storyline, I don't know, all the stories that were coming up and how, the different versions of it we had already seen on TV and what we wanted to see and the conversations we wanted to have, it just slowly became, cancer became one of our main villains for the season. And it was like, how does this permeate through the kids? How do parents, like the things that they tell the kids versus what they hide from the kids because they don't want to scare them. And how, so it's like, it was a great story engine in so many ways, but it was conversations we wanted to have, uncomfortable conversations that we all wanted to have, juxtaposed with superhero fights, and the kind of the big world that comes with it being Superman. But at the end of the day, why I love writing for this show is because it's just a family drama, and it's about a husband and wife who are trying to balance their careers, which happens to be superhero stuff, and their kids and real life and things they can't control. And so having those conversations, it really was it was important to us. And it was, the more we talked to survivors, the more everyone in the room had different stories. Again, about whether it's their family or their own experiences or different scares. I definitely had a lump that I went to it's like you have your own journey and your own fears, and all that stuff comes into play in these conversations. But the intimacy conversation we felt was really important between Clark and Lois, and what it feels when the body you've lived with is about to change, and our ideals of femininity and what it means, losing my breast, does that mean I'm going to be less of a woman? I don't know, in talking in the room, we just wanted to have those conversations on TV, just because other people are probably having them too if we're thinking about them. And just how that affects your marriage. If you as a woman no longer are feeling sexy and beautiful, and like we're saying, the menopause, you might have menopause. A lot of women have to freeze their eggs. Young women who aren't even thinking about kids are being told that they probably won't be able to have them later, or whatever. And it opened up a lot of story and conversations we wanted to have, and they were deep, and we were definitely very aware. We don't want to be like the cry every episode, sad season, but which is why it was important for us to show the hopeful side, and for to show Lois living with cancer, and to show her having a full life and being hopeful for her kids and her family, but also vulnerable at times.
Yeah, it was great. And also, she planned for her demise. She did some planning just in case. And, it freaked her kids out and freaked Clark out. But, she's being realistic about it. And I think that's also something that if you're around tomorrow, we're doing a panel on end of life. But it has to do with, you got to be real about these things and think about what if this happens? What do I want? How do I want to deal with that? And what do I want for my family, and involving them in that conversation as well. So we did a panel on women's health many years ago now in New York at the Writers Guild East. And we had a breast cancer survivor come and tell her story, and she was an African-American woman. And she stood up and said, I thought breast cancer was a white woman's disease because everybody on TV, even in the news, everywhere, it was always a white woman that was facing breast cancer. And she was African American, and she said, so I was diagnosed like stage 4 because I didn't think I need to go get checked. Anyway, thank goodness she's alive and she survived. But Gray's, Maggie's mom, African American woman, which I think is a very novel portrayal for this, even though, Black women get breast cancer all the time too. And especially the other piece of it is a younger woman, that young women face the threat of breast cancer more than we think. And it's important to be aware of that. But I'd love you to talk more about Maggie's story and also Maggie being, the daughter of this woman with breast cancer, and she's a doctor herself, and she's kind of can't do anything about it, and she's very frantic, and so how it affected her mental health as well, and her sort of feeling around all of that.
Yeah, and if you know the character of Maggie, she's very like, I have to do everything. I'm a genius. And well, she's literally a genius. And, with the breast cancer story, she was very emotional that her mother really didn't want to do everything. And, it came to a point when they realized that there wasn't a lot that could be done for the stage that she was at because of the fact that, she was told she had a rash, and she had actually come to the physician and just said, can you just take a look at this? And then by the time she was diagnosed, it was a little late for her. But Maggie, kind of went overboard and tried to get her in clinical trials and tried to tell her about this and that and all of the other things, and really, really worked hard over multiple episodes to get her to do all of these extreme things. And finally, her mom had to say, please stop, and it pretty much devastated Maggie, and she had to step back and not be Superman, and let her mom live her life on her terms. And so they had a beautiful goodbye, and once Maggie was able to deal with that, then she had to, be there with her, be there for her. So that was kind of the thing. But what you were just talking about made me think about the other panel that we did that was during COVID, so it was Zoom. But the other lady, was this the same lady who had the stage 4? She was a Black woman who had been, and she was a nurse, who had been told over and over, you don't need testing, you don't need a mammogram, you're not old enough, blah, blah, this is not gonna happen. And then when she was finally diagnosed and she finally pushed and advocated for herself, she was diagnosed with stage 4 cancer. And she was amazing, this woman. And I think they've changed the age of mammograms just recently. To 40.
But go sooner. Yeah, it should be younger.
And it happens a lot younger in a lot of Black women also. So, I hope that, our stories have had something to do with just putting it out there and letting people know, along with also, obviously, the advocacy of the people. But we like to bring these things to light, like your, just the models that we have these stories based on, and just really publicizing them and letting people know that this is happening and these are out there. But I feel like the story about the clogged milk duct also kind of was in that vein, because she was very young, so she was like, no, this must be what it is. And so to just, have more stories about, you can get it when you're young, you can get it when you're Black, you can get it, it's just letting marginalized communities see themselves on television is always a plus. And Grey's Anatomy is kind of known for kind of bringing that to the fore, as far as just having a cast of color and not really making a big deal about it. It's just the way life is and the way that Shonda saw life when she created the show. So and just putting marginalized communities in those predicaments, and having those things just really, you can't be what you don't see, kind of thing.
Has Station 19 done a breast cancer storyline? Because if they haven't,
Oh, we were thinking about it.
okay.
We
well,
we
you know
talked
who to
about it in the
call,
room.
right?
Who?
HHS.
She has like a video of me talking about how I don't even understand how they can possibly do any other shows, because Grace calls them like every other week. I'm sorry, every week.
Yeah, pretty much every week.
Many times a week.
We're scrappy, Well, think about it for Station 19. Just saying.
We have
just
thought
saying.
about it.
I want to get into what you just alluded to in terms of impact and how these stories really affect audiences, or do they? And I want to ask you guys, with The Simpsons, did you get fan letters? Did you get people that, reached out and said, I love Uniboob, or thank you for, I felt seen, or, and even beyond that character, other issues that you've dealt with on the show, do you get audience response? Do you get people writing letters saying, thank you saved my life?
You talk, honey.
Oh, what a husband.
I can go on about this topic because it's been very impactful, but Matt has a Twitter presence and
Decreasing,
thankfully. Spent a lot of time on that. And the day after the episode aired, where the Wendy Sage character was on there, he got a message from a woman who typed that. She was writing him from her hospital room, and she had just had a mastectomy, and she was watching the television and saw the episode with Sage and saw the mastectomy and saw herself represented and said, I'm crying and I know I can do this. And, that's I don't think you can get a lot of those messages.
we do get a lot of, Homer's my favorite.
Like someone, I got a message from someone who said, my 12-year-old daughter was in the living room and started screaming, Mommy, come in here, there's someone else missing a boob on TV. And, that's the kind of impact it has when people see this represented, and you have to be looking for it, kind of. You have to go like, something's odd. Oh, right, there's a breast missing. In my own advocacy, I kind of make these T-shirts and give them to my friends, my flatties, my uni friends, and it's because we really have been empowered by seeing ourselves represented, and kind of take this activism to the street during Breast Cancer Awareness Month, and let other women know that it's okay to look different after cancer treatment. There's a lot of women struggling with their bodies. There's a lot of women struggling with, certain types of reconstruction with implants are not always comfortable, and it's a never-ending maintenance situation. So sometimes we give power to those women who are considering removing their implants, which would mean going breastless or having one breast, and we say to them, it's okay to look like this. It is okay to have treated yourself, to have lost a part of your body that's sacred, that is like, yes, it's femininity, but it is motherhood. That's what breasts are for. And to say it's okay to take that off to save your life and to be here a little bit longer. So.
Well, Renee also, did we say this already? She crafted the look of the character on the show. So she put in details that I think people who know people with cancer or been through breast cancer would never have expected to see in a cartoon. Like the port scar, right, which is where the infusion goes in. Right. Doctor wife, and she's not a doctor. And, like the curly hair from when you've had chemo and your hair grows back, like Renee, put in those details. And, our show is good for that and that, but usually we would put details in for a movie parody or something more pop cultural or something very silly or just something from TV or food. But to use it for a different type of reality was really fun and, meaningful for us.
Yeah, I like to tell people that the animation kept coming back, and
A lot of notes.
a lot of notes for me, a lot of notes, because her flat side, like I said, we need to see her in 3/4 so you can tell big boob, no boob, and the no boob side kept coming back kind of convex, and I was like, no, it has to be concave. When they take your breast tissue out, sometimes you're a little concave, and I know a lot of people haven't seen that, but when she landed, people were on did you see she's kind of concave? That's great. That's how it looks. And so, like what you do at Hollywood Health and Society, you make things authentic. You bring in people who know that you had to be flat to know to do that, or a breast surgeon, like we have a plastic surgeon in the audience, Dr. Potter, who's amazing. That's the kind of person you have to have it experienced, or the surgeon who does it knows what that looks like. So
Yeah, great. That's fantastic. So I have some data on Superman and Lois and Grey's Anatomy's breast cancer storylines, but I wonder if you have an anecdote also that you want to share, or maybe it's too soon since this is this season. Have you guys gotten letters? Have you seen anything on social media saying thank you?
I've gotten a lot of Twitter, which I'm slowly making my way off of, but definitely a lot of people and a lot of phone calls from, like I said, everyone in the room has had someone who's had breast cancer, and a really good family friend of ours had a double mastectomy in November, and her daughter is a huge Superman and Lois fan, so they watch every week, and every week I get a message, and it's just she's emotional, but she's also, it's hopeful, but her daughter is like, Mom, Lois is like you, which is very, very sweet, and it really makes it worth it. I consulted with her a lot on the show, to write the show, in addition with you guys. So definitely messages like that. Also, I'll say the other side is definitely get mixed into the tons of good ones. There are a few who are like, this isn't my experience, and it's because everyone's experience is so different. And I wish we could show that. We really did try our best to show the journey to the best of our ability in 13 episodes. So it's mostly very positive and people being grateful, and then a couple that are just like,
Yeah, well, you got to have a few of those in the mix too.
Did you get pushback from the network where you said we want to give Lois breast cancer?
I think it was, Superman represents hope, and we were like, we know. So that was the first conversation, and then we were clear, we'll make sure it's hopeful cancer. Did you guys?
No, we just did it.
Yeah. Do you even get notes anymore?
Yeah.
I just, ask, what is it with expression? Get slap on the wrist later is better. Yeah.
Do it and ask for forgiveness later.
Go ahead, end the show. We've had a good run.
I was going to say, I don't think they're going to argue with you much at this point. And what about you, Zoanne? I mean, you mentioned the one, impact or the email from the friend who said, this storyline of Maggie's mom inspired me to go get a double check. And sure enough, and I think when you told me that story first, you said that the subject line in the email was Grey's Anatomy saves a life, which gives me cold chills every time. But anyway, other anecdotes or anything on any of these storylines or anything else on women's health?
Well, you had one for the clogged breast duct, right? That I
Yeah.
had never even heard.
Oh, well, okay, so I'll tell you. So the Justina Machado episode, which I think was season 3 or something, where she's just given birth, she has a clogged milk, or she thinks she has a clogged milk duct. They keep telling her that's what it is, and then they find out that she does have a lump, and the whole storyline. I read an article about a woman in Israel So Grey's Anatomy is shown pretty much in every country around the world. It's translated in over 60 languages. We've seen people in the slums of Delhi crowded around a little TV watching Grey's Anatomy. I mean, it's pretty amazing.
It follows me around the world.
It does, yes. And anyway, there was this woman in Israel who had just had a baby, thought she had a clogged milk. You know, the whole similar story wasn't getting listened to by her doctors, and saw that episode, and same thing. Went back, they found it, they caught her. You know, they caught it, saved her life, and they did a whole story in like Cosmopolitan magazine or something about she claims her life was saved by Grey's Anatomy.
We get a lot of those claims. Not just about women's
I was
health.
going to say, that's what I mean. What else? I mean,
there's been a lot through the years, and you know, we very much understand our responsibility on the show and the amount of impact, and we play to it. Like we also don't get notes. So
Awesome. It's pretty sweet,
so I
right?
guess it's like the 15-year mark approximately. That's when you'll stop getting notes, Kristi.
Was
Okay.
Earlier, we had Sean.
Well, you had Sean.
She's a force. But yeah, like we go into like social justice things and just like pretty much just social issues in general, as well as health issues, and you know, we've been more and more tackling like race issues, like really just head on, like going into those things. And COVID actually helped a lot with that. COVID helps.
Got the COVID bump.
Yeah, we were able to talk about a lot of the discrepancies in healthcare and just, you know, in marginalized communities and all of that through the help of COVID, and then of course George Floyd and all of that, and just really pull that into the show. And since then, like really push a lot of issues. Women's health, abortion. Had a lot of abortion on Grey's Anatomy this past season, and
last few
just what
seasons.
Roe v. Wade, the impact that it could potentially have. And we had to do, immense amounts of research because it hadn't really happened as far as like what was going to be the impact. So we had to, you know, not do the doomsday scenario, but also say, what if, and to kind of go there. So we did a lot of that this past season too.
Yeah. Okay. So I want to
Without
leave.
the network here.
Yeah, it's the same strategy, right? Do it and then apologize later if you have to.
I have a question. Do you guys feel like you have a mission statement to give viewers the tools to stand up to like doctors, often male older doctors who are dismissive of these claims? I mean, I feel like that is an exciting thing that I bet you guys are doing.
We are doing it. It's not, I wouldn't say it was our mission, but like our mission is just to A, advocate for yourself, B, to kind of know what's out there and the different kinds of things that could happen, and just to have a knowledge base. Like, so I'm a physician, like an emergency medicine physician, and
Oh yeah, there's that.
and like my whole validity to not being out there and saving lives, you know, in person as a doctor, and just working in TV, which seems fluffy until you think about entertainment education and how much information you can get to the world, like literally every week in their homes, in their living rooms, with these people that they love. And it just has basically validated my experience and my whole kind of mission statement of being on Grey's, and just being able to kind of do all of that and forward those messages and those missions.
I remember you once told me that, because didn't you work in the ER? So she's an ER physician because, you know. And
That's what you do.
That's what you do before you become a showrunner on, you know, whatever. Anyway, but you said like on a busy day, maybe you reached 50 people with patients and family or whatever. And, you know, on one episode of Grey's Anatomy, she reaches, you know, 10 million people. And that's just in the US. And then when you think about globally. So yeah, I think you're doing okay. And thank you for your service. So I just wanted to give, I want to leave a couple minutes for questions, but I just wanted to give you some data that we gratefully, our partners at Ogilvy, who are supporting our work around breast cancer on TV, just did a little research on both on Superman and Lois and the most recent Grey's Anatomy breast cancer episode. And so that breast cancer episode aired in April, and it had to do with, I think it was inflammatory breast cancer also, but at any rate, during April, here's a word for you guys, nipple discharge was more associated with breast cancer in online searches. So with Toby's primary symptoms on the episode included nipple discharge, an increase in Google searches suggests people are now considering this a cancer symptom instead of exclusively associating it with pregnancy. And I wish you could see my little graphs I have here, but Google search for Superman and Lois, Google searches for breast cancer in young women in March of 2023 jumped by 2.5 times that of compared to previous month, or March of 2022. So, and 336,000 online mentions regarding breast cancer, with 35,000 driven by Superman and Lois. So they were looking online for connections of Superman and Lois and breast cancer. And again, my little graphs show big spikes when the episodes air and searches for breast cancer, young women in breast cancer, nipple discharge, whatever. So people are doing that. I mean, they're watching and they're immediately, taking action. So it's very exciting to know that. And, our partner organization at the Lear Center, the Media Impact Project, does this kind of research as well and looks at even more in depth that the impact that TV storylines can have on audiences by surveying audiences before they've seen an episode about a topic and then again after, and looking at the knowledge gains, the attitude shifts, and even behavioral intentions like, yes, I'm going to go get a mammogram, or whatever it is. So we're always really excited about this kind of data. Another one here is Google shows a peak index of search query breast cancer support groups immediately after Clark went to the support group in Superman and Lois. So, I mean, that gives me cold chills. It's just really interesting. So anyway, yes, these shows do a lot more than entertainment first always, but they do a lot more than that. They reach their audiences with vital information, with healthy positive modeling, with inspiration, and also acceptance that, it's okay to fall apart. It's okay to have a body that doesn't look the way, the majority of the world wants your body to look, and all of those things. And you guys so I applaud all of you for all the great work you're doing. And we've got a few minutes left, so if there are questions from the audience, yeah, go ahead. I don't know if we have mics, so just stand up and shout. Or just shout from your seat, whatever you want.
I was wondering about, you guys are dealing with really heavy topics, right? So it's actually kind of a two-part question. Is one, how do you kind of balance that line between being entertaining and being pontificating, I guess, right? And also, you said you were asking for forgiveness later, like, the abortion topic is a pretty hot potato, right? And you're taking it on, but is there too hot of a potato? Like, are we not going to go somewhere because it's just too much that the execs are going to say no? Do you?
Yeah, it depends on who you're talking about. If you're talking about these guys, I doubt there's a hot potato. If you're talking about executives, that's a whole other thing, but I'll let you guys answer.
Okay, the first one is you always start in character. So, where's your character going? What is their journey? How is this topic going to influence their next decision, or where we want to take them? And if it, like for Grey's Anatomy, obviously, it's a health show. So, medical show. Not a health show, but a medical show. So we're always trying to figure out what our characters are going to be tackling. And if it's a hot button issue and it gets them there, you know, if it's just a lesser issue, like there's not really a lesser issue in health because it's going to affect somebody somewhere. But, you know, if it's a hot topic issue, if it's a hot button issue, then so much the better. Like we will just kind of go for it because we do kind of have carte blanche after 20 seasons. But is there something that we wouldn't? I mean, you know, there are some things with the abortion storyline that we didn't go as far as we would have liked to, because we still do want to reach those middle people, you know, the people who are like, we're never going to reach the people who we're not going to reach. But there's those middle people who are just like, I don't know, maybe, you know, and we want to still be able to get to those people. So we don't want to go like crazy leftist far, you know, just like, but, you know, progressive and just basically talk about the facts of the situation and not try to we put the character's emotion into it, but not like make it emotional and this is where we think it's gonna go and we gotta fire it up. You know, it's just like, this has happened. This is what we're portraying on television and dramatizing it. So that's why I was saying like, it was kind of hard at the beginning of it because it had just happened and we had a lot of like, thoughts, you know, we talked to a lot of people from Hollywood Health and Society and just a lot of doctors, a lot of OB-GYNs who were saying, this is where I think it could go, and this is the worst case scenario, and do we go with the worst case scenario or do we pull back a little bit and just say, okay, well, we know that this particular thing has happened. Like for instance, there was the one, was it a 12-year-old who had an abortion because of rape in
Indiana, or she had to go to Indiana to have the abortion.
But then the doctor got charged.
Yeah.
But at the time that had happened, we were like, we want to do that story. But at the time it happened, we didn't know what was going to happen with the doctor, and so we just never really went there with that, and we went a different direction. We're still telling the story, but just kind of not that involved. So there was some stuff that we kind of pulled back on.
I have a topic that I think is very deep and very pushes the buttons, and I don't think it would be executives that would say no. I think it would be, the first one is the direct link, between alcohol and breast cancer. And I see so many fundraisers that are literally called boobies and beer and stuff like that. So great, you want to raise funds that way. That's called pink washing. You need to put a sign up and says, hey, the new studies show more than 2 drinks a day is linked to breast cancer. And an even bigger one that I would love to see do, will not happen on The Simpsons, I know, because this is dark.
Duff equals death.
Is a story where a woman dies from the implants that are put in her breast. Okay? Women don't even want to talk about that because this has been so normalized to put implants into your body. And there are some women who won't get ill, but there are a lot who get sick, and there are some that die. And that's a story I'd love to see somewhere.
Well, sorry, but I mean, you brought that up. I got really mad at Susan Cohen after my mother died, that their sponsor was Yo Soy bars, and they're handing Yo Soy bars out to the people walking in the marathons. I'm like, are you kidding me?
Right, so you're talking about estrogen-driven cancer and then soy and...
You're supposed to be the expert, and you're not, so yeah.
One of the breast
KFC buckets, right?
At
buckets.
one of the breast cancer walks, the sponsored beverage, although not carcinogenic, that they were handing to the women was that liquid death. We're just like bad optics sponsor.
Another one at a Common Walk, wristbands that said "Save the Tatas," giving out to stage 4 breast cancer patients, some who don't have breasts. But people think it's funny, and the pink color sells. So those are some.
So the answer, part of this is know your audience in anything you do, right? Other questions, because I know we got to wrap up soon. Okay.
So I just want to say, as someone as a suppressor struggle with Clack, I cannot tell you how much it means to me to see that representation. I just never thought it was going to happen. Obviously, the I'm wondering if there's any room in any writing, any story, to show someone who has stage 4 that's living and thriving and living for a long time, and not just like, oh, you have stage 4, oh, next thing you're in hospice, and oh, you know, you're just, because my treatment, I lose my hair, I'm just got back from Costa Rica, running around, and, I would love to see that kind of stage 4 needs more hashtag.
And the positive aspect of that is like the treatment is allowing women to live with it as a chronic illness, and to not have to show it on death's bed, right? But to show like what does that look like, and it's challenging, right? It's not a walk in the park, but that is a story that needs to be told.
So it's like, when I told my kids, they were like, oh, well, we have 2 years, like it's like that's what people think, and people are like, oh, you have stage 4, that's weird, you don't look like it. I'm like, well, what does it look like? And I only know one celebrity, I think Shannon Doherty is like sort of one of those nice thriving and talking about it. But it's stage 4.
Well, the woman that you mentioned that was on our Zoom panel discussion, she was stage 4, and she's got a farm, and she works, and she's, living her life, and has her hair, and, and she's stage 4. So.
Yeah, if we did get a season 4, I think our goal was to show, Lois she's stage 3, but to show her living and thriving with cancer, like you said, as more of a disease and not as a death sentence. So, yeah, back there.
A lot of the barriers you talked about today as far as treatment are like not recognizing symptoms soon enough to go see your healthcare professionals. I worked in the hospital system for 12 years as a financial counselor, and a lot of what I saw was by the time someone was brave enough or had the support to go seek some kind of appointment or diagnosis, they couldn't afford the treatment. So what kind of conversations were happening in the writer's room about exposing that part of our healthcare system, or maybe using that to influence voters?
That's a hard one because our hospital cannot be seen as bad. And our doctors would just advocate for that patient and pay for their treatment, which is not
Heroes.
a reality of healthcare.
Couldn't there be like a bad one next door?
I think Amsterdam.
Yeah, I was going to say New Amsterdam did a lot of that.
Well, there are doctors who do that, who pay for their patient. I mean, I'm here visiting one of the premier surgeons in Austin, Dr. Potter, who, as they're trying to take one of the options away from women after breast cancer called deep flap. It's the one where you use your body, some fat from another part of your body, move it up, and it's once. It's a rough surgery, but once you're through it, you're through it and you're done. And the CMS, which is getting technical, but basically the government's trying to take that code away so women won't have that option anymore. And this woman is fighting for it. Dr. Potter, you're amazing. And people will come to see her, and she will, if their insurance is denying it, she is doing their surgery. So that's kind of just what you said. That's real life happening.
That's Grey's Anatomy.
And the American healthcare system, yes.
We had a lot of conversations about finances in the room for Lois and Clark because they're journalists. I mean, Clark doesn't get paid. Superman doesn't get paid. They're like really struggling. Sometimes we're like, how do they even afford the house? But we had conversations about like we wanted scenes, and even in some scripts there were like scenes of them on the phone for hours, going through bills, and like because that was a lot of the conversations we had too with people, and even like I said, the people in the room have dealt with this too. But like the hours you spend with the financial people and trying to like pay your bills that are suddenly astronomical and fighting to get surgeries paid for that you need to live, and so it was just, and we had to cut them for time is what happens. And it's so frustrating because it's like, you need more than a season on a network show. I guess a streamer needs to do it where they have like, it's not, because our hour is like 42 minutes. Streamer, you get like, it's like an hour plus, so maybe that's what needs. But I do believe, just back to the self-advocacy and everything we're talking about, and I think that's why inflammatory breast cancer is something our shows have tackled more recently, is because it's symptoms that are not just lumps. It's like be aware of rashes, of discharge, of any number of things. And Because I think women are really great advocates. Like, I don't know, if something's wrong with me, I go to a doctor. But when it comes to my mammogram, I'm definitely a little bit more hesitant, and we've talked about it. It's like a torture device, and it's like they should have absolutely upgraded it by now. And so it's like we need to we need like a challenge, like a yes ma'am to the mammogram, like thing that we were like, I challenged 3 of my friends, I just got my mammogram, and we're all like, yes ma'am to the self-exam. Yeah, mammogram party, let's do it. But like,
I
we
just
need
think,
something.
I think if men had to put their private parts in that machine, we would have new innovation already to fix that.
Well, tell me more about this machine. I'm intrigued.
So maybe that can be a new. Anyway, all right. Well, I think we have to wrap up. Sadly, I just have to say this because I've been binging Superman and Lois. Is that it's so funny where they'll be talking about whatever, and then he'll go, I gotta go. Boom! And he's like gone. And she's like in the middle of a thing, and she's like, go ahead, honey, like go save whoever. And it just cracks me up. But then my husband kind of does that too every now and then. Yeah, he doesn't fly, but my husband will kind of walk out in the middle of a conversation too. Anyway, let's thank our panel. Thank you all so much. This was fantastic.